Welcome to the Speaking of Women's Health podcast. I'm Dr. Holly Thacker, your host and author, and this is the last roundup. We're back in the Sunflower House, finishing up the Cleveland Clinic Guide to Menopause. And this part of the podcast is going over the appendix of the book. And we have a lot of great tips on preventive care, including health screenings and lists to help you prevent some common problems that can plague women as we age. So in terms of general preventive care, breast cancer screening has been at the top of many women's minds, and there's been various recommendations about when to start. For the average woman without a personal history or a family history, we start baselines by age 40 or even up to 45. And most organizations recommend a yearly mammogram, and it's best to do it after your menstrual period or after the progesterone part of your cycle if you're on cycled menopausal hormones. But the American Cancer Society and many other organizations recommend that once you're 55 to 75, if you have just average risk, meaning you don't personally have breast cancer, you don't have a known genetic mutation such as BRCA1 or BRCA2, or there are several other genetic mutations that can increase breast cancer and ovarian and other cancer diagnoses, then really you can go every 2 years. And we'll have more podcasts and discussions about breast risk assessment and about who is appropriate for genetic testing. And I do tell my patients that once you are 75, you get to graduate for mammograms. However, and that's for the screening portion, you can be 105, and if you have a breast lump, we will do a mammogram and evaluate you and treat you. So it's not an ageist thing. It has to do with preventing premature death. The last thing we want to do to an older woman or an older man with prostate screening is overdiagnose something that's not going to affect their lifespan, but might negatively affect their lifespan by making them into a patient. Cervical cancer screening usually begins in the 20s, and we usually want to do a pap smear at least every 3 years between the early 20s up to 30, at which point we like to get a thin prep pap and an HPV by age 30. Now, we get the HPV sooner if the pap is abnormal. And it's very important to do both of these. And even if you don't need a scrape of the cervix every year, you still should be evaluated at least every 1 to 2 years. Colorectal cancer screening. We're now starting that for average risk people at 45, but you may need to start sooner if you have a mutation such as Lynch syndrome, or if you have symptoms, or if you have a family history, you may need to start earlier. As an adult, you should know what your cholesterol is at least every 5 years. And if it's under 200, you don't necessarily have to get the good and bad ratios, especially if your blood pressure is normal and you're young and you don't have diabetes and you follow a Mediterranean diet. But if the cholesterol is over 200 or you have other cardiovascular risk, then you really want fasting cholesterol ratios. And if you're a woman who's not on any oral hormone therapy, which can artificially elevate the ultrasensitive CRP, that can further health stratify. Every adult should have a blood pressure checked every year. And once you're 45, we do a fasting blood sugar every 3 years. Sooner if you're overweight. Certain ethnicities, such as American Indian and Hispanic and Black Americans, many times have slightly higher rates of diabetes, so we may want to check sooner. Pregnant women, of course, need screening for gestational diabetes. And if you have a history of gestational diabetes, you need to let your medical clinician know that, because that puts you at future risk of not just diabetes, but also sleep apnea, which we talked about in the sleep chapter. I usually like to get a baseline bone density for menopausal risk assessment within 2 years of menopause, or certainly by age 65, sooner if there's risk factors for osteoporosis or bone breakage or family history of hip fracture. We're pretty liberal about checking thyroid function since 1 in 8 women can be low in thyroid. And I will get some blood work such as B12 levels every 5 years if persons are on medications that lower B12 or once someone is 60 to 65. Now, certainly women that are on medications such as glucocorticoids or steroids, certain breast cancer treatments, medicines used to treat seizures, blood thinners, or excessive thyroid medicines can accelerate the rate of bone loss. So can women who leak out too much calcium in their kidneys, which can increase kidney stone and bone breakage. Certainly, lifestyle is very important. Limiting alcohol use, because there's really no safe risk or ingestion level for breast cancer. We frequently say definitely do not go above 3 to 5 drinks, absolutely maximum a week. Smoking in any amount nicotine is not helpful, and neither is recreational drug use, which you should come clean and confidentially discuss with your healthcare clinician. We recommend wearing a seatbelt every time you're in a vehicle and not texting and driving. Eating a healthy, nutritious, colorful diet is very important. And for many people, intermittent fasting is anti-aging. We do like you to create a living will and medical power of attorney, and everyone by age 18 should have this done. Discussing appropriate immunizations if indicated, depending on age and history. We talked about cervical cancer screening. There are additional breast imaging. The 3D tomo mammograms do involve more radiation, and they're not indicated for all women, but if you have dense breast, it many times is harder to screen the breast, and there can be more false positives, and the 3D tomo mammograms may cut down on this. Under labs, I think one of the most simple things to improve health, reduce cancer, reduce infections, help the bone, help the mood, is treating the widespread vitamin deficiency that's very common, particularly in people over 40 and in northern climates, also in darker skinned persons. And those are probably my 2 most commonly recommended supplements. Is first vitamin D, and I think if you get D3 with a K2, the K2 helps get any extra calcium into the bone. And magnesium, it's important in many enzymatic processes, and sometimes women don't get enough magnesium in their diet. Now, when talking about bioidentical hormone and biosimilar hormone, in some respects it's kind of a marketing term, but you can use the term appropriately, bioidentical, if you're just talking about estradiol, the human estrogen, or natural progesterone, which is commercially available as Prometrium mixed in peanut oil. There is now one combination estrogen progesterone capsule in coconut oil called Bijuva. And it only has 1 dose currently, and I hope we get a higher dose and a lower dose, because I really do feel like as a menopause specialist, I could use 3 doses depending on the patient population. Now, biosimilar hormones are hormones found in hormonal contraceptives, which include synthetic ethinylestradiol and many different types of progestogens. And there's a combination of bioidentical, biosimilar menopause hormone regimens with bioidentical estrogen and a variety of different progestogens that can be taken orally with or without food and are well absorbed and protect the uterus. So hormone therapy, including the biosimilar therapy and the mixed bioidentical biosimilar, is a very important option for women, and it does still remain the gold standard for minimizing menopausal symptoms, treating changes in vitality, and maintaining and protecting bone strength. And hormone therapy is successful when it's tailored to the individual woman. Women and their caregivers need to be aware of pitfalls of compounding pharmacies in which hormone doses are not standardized or regulated. Even bioidentical estrogen and progesterone is synthesized in a lab. So because something is synthesized, it doesn't mean that it's artificial or synthetic. And as I like to say, somewhat jokingly but also true, just because something's natural doesn't mean it's desirable. Death is natural. Hurricanes and tornadoes are natural. Manure is natural. Radon gas is natural. So usually by the time I get to the manure, the woman's smiling and gets my point. Get to sleep, for heaven's sakes, because getting enough sleep helps prevent weight gain. It's great for your brain rejuvenation. Sleep disorders are so common, and hormonal variations across a woman's lifespan are more likely to be diagnosed during midlife. And when sleep apnea in postmenopausal women goes untreated, it's a risk factor for heart trouble, high blood pressure, atrial fibrillation, sexual dysfunction, uncontrolled hypertension, and weight gain. Unusual sleep disorders, such as sleep-related eating disorders, can also have serious consequences, including diabetes. And yes, your sleep patterns will change as you age, especially during menopause. So tune into your sleep concerns and discuss them at your office visit. Osteoporosis, building bone health in midlife. Osteoporosis is not a normal part of aging. It can be prevented and treated. Osteoporosis does not cause symptoms until you break a bone. Early awareness, regular weight-bearing exercise such as walking, making sure you ingest enough calcium, preferably in your diet, but you may need a supplement, as well as likely needing a supplement of D3 with K2 are key. Painful compression fracture of the spine can lead to dowager's hump, cause height loss that's irreversible, and is very common, unfortunately, in older women, and it's usually always caused by osteoporosis. Vertebroplasty and kyphoplasty are surgical treatments that might be considered for compression fractures to help relieve pain, restore some of the lost height. But it's critical that these severe osteoporosis be treated so that more compression fractures don't occur around the kyphoplasty. In terms of keys to healthy joints, most people over the age of 30 start to develop some degenerative arthritis, osteoarthritis, degenerative disc disease. So eating a healthy, plant-based diet with brightly colored vegetables and fruits high in oxidants, getting enough vitamin D, reducing daily biomechanical stressors, a common trigger for joint pain. Try exercises easier on the joints, such as an elliptical or water aerobics or swimming. Stretch before and after exercise. Consider an inversion table if your physician thinks this may be helpful to stretch out your back and your knees. Aim for 30 to 60 minutes of physical activity daily. Please do your best to lose excess weight. Even 5 pounds places unnecessary stress on the joints, and 5 pounds translates 5 times. So if you're 10 pounds overweight, that's 50 extra pounds of pressure. For women with some degenerative knee pain and joint pain, for a lot of people, the golden number appears to be 13 pounds. And while you can't shed 13 pounds necessarily overnight, of course, you can stop carrying a heavy purse or carrying your heavy grandchild around or carrying huge bags of heavy groceries all at the same time. So be mindful of the stress you're putting on your joints. Wear good shoes. And glucosamine may help reduce arthritis of the knee in postmenopausal women, and you really need to try it at least 1,500 milligrams for 2 months before deciding whether it helps your joints and going on a maintenance level. There are many other supplements. Turmeric is anti-inflammatory, but you need to consult your physician, and I would recommend you go on our speakingofwomenshealth.com site. We have a lot of information about joint supplements for pain, for muscle spasm, lots of helpful tips on exercise. What about building a better memory? Well, the ability to learn and recall new information can be affected by many factors, including normal aging, situational factors such as stress or poor sleep, untreated mood disorders, hormonal deficiency, medications, and other underlying medical problems. So in terms of how hormone therapy affects memory, it's complex, just like with how it affects heart disease. Certainly in a woman within 10 years of menopause under 65 who has menopausal symptoms, it does seem to be associated with cognitive benefits, less brain fog, better word finding ability. In women that already have memory loss, maybe who've had strokes or who are over age 65, certainly oral estrogen in the MIMS study may increase further memory loss. So we don't use estrogen in older women who have cognitive decline. Lifestyle factors such as mood disorders and medical variables are far more likely to result in memory difficulties than just normal menopause. But it is individual, and there does appear to be neuroprotective benefits to estrogen on the neurons and acetylcholine transmission. Maintaining a healthy lifestyle is always key. Reducing stress, exercising your brain, working closely with a trusted physician to ensure optimal health. That will help maintain your memory functions through life. Managing mood disorders. Women are more prone to depression than men, particularly during times of hormonal fluctuation. Whether it's postpartum, whether it's premenstrual, or whether it's a prolonged, difficult perimenopause. And there is treatment available for hormone-related mood problems. And medical depression is common and it is treatable, including psychotherapy, cognitive behavioral therapy, and lifestyle changes, as well as in some people, prescription medication. But please see a physician to rule out medical causes for depression. Check hormone levels, thyroid levels, B12, zinc, chemistries, blood count. Acupuncture. Well, acupuncture is an ancient healing art. And traditional thinking about why acupuncture works is based on really a different understanding of the body's anatomy than what we use in Western allopathic medicine. It's based on qi, a person's life force, and the pathways or meridians through which this force flows. Many studies show acupuncture safe and effective, and that it releases endorphins and activates your morphine receptors. Acupuncture affects the neurotransmitter chemicals in the brain that can affect mood and pain perception. And certainly low-dose naloxone is a medication that in high doses blocks opiate overdose, and in low doses seems to help modulate pain perception. Prevent stroke. Stroke is common, especially in women with high blood pressure and in women over age 65. When a stroke occurs, it's a brain attack. Call 911 immediately, because the longer that medical attention is withheld, the more brain tissue and thus brain function dies. Know the risk factors for stroke. Screen for high blood pressure, diabetes, atrial fibrillation, high cholesterol, and heart disease. Reducing these risks are the best means to prevent stroke and heart attack. Aspirin is indicated in low dose in some people, but you need to have a risk of stroke generally greater than 30% or known atherosclerotic disease. Certainly don't smoke. Eat a healthy Mediterranean diet and support friends and family who are trying to quit. Try to keep your waistline under 35 inches, even under 32 is better. And appropriate exercise. Get heart smart, because most women will die from cardiovascular disease as well as most men. And cardiovascular disease is a term that includes hypertension, coronary artery disease, congestive heart failure where the muscle's weak, stroke, and congenital heart disease, which can occur from birth. Interestingly and importantly, symptoms that women experience during a heart attack may differ from those that men experience. In addition to chest pain or discomfort, women may have nausea, vomiting, shortness of breath, fatigue, lightheadedness, back pain, jaw pain, or simply just a lower ability to get things done that they previously could do. Risk factors for heart disease include age, family history, high lipids, which is cholesterol and triglycerides, high blood pressure, sugar diabetes, cigarette smoking, and weight gain. And diabetes and high triglycerides seem to be more potent risks for heart disease in women compared to men. Should you purchase medicines online? Well, online pharmacies have become mainstream. Some medications are cheaper online, but not all. And sometimes you need to undergo a telemedicine or cyber doctor consultation.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we are the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
And medicines purchased online, you must know where they're coming from, if it's legal to import it from another country, and where the prescription is being made. Anyone using internet pharmacy should be advised to only use sites that have verified internet pharmacy practice VIPPS logo, indicating they've met standards set by the National Association Board of Pharmacy. I've certainly learned about ordering medications from various Canada drug websites because many of my Medicare patients told me that they could not afford both medicine and food if they had to go through their, quote, insurance or the pharmacy benefit managers. And there's a great review article on how to save money on medicines written by my fabulous center nurses called How to Save Money on Medicines. So if you just go on speakingofwomenshealth.com and put in the word money in the search button, in the search, magnifying glass, it'll pull that article right up. What about managing migraine headaches? Well, migraines are 3 times more common in women than men, and certainly hormonal changes can have negative effects. And most people who have headaches incorrectly diagnose themselves as having sinus headaches or tension headaches. And most sinus headaches are actually common migraines. And if you treat headaches with over-the-counter medicines more than 3 times a day, you can get rebound headaches. Keeping a headache diary can certainly help you avoid triggers. And riboflavin, B2, is an important B complex that helps reduce migraines, and so does magnesium. There's classic migraines. There's several different migraine triggers, whether it's stress letdown, ovulation, dieting or fasting, fluctuations in caffeine. Many foods can trigger migraines in some people, such as aged cheese, luncheon meats, sausages or hot dogs, onions, chocolate, yogurt even, MSG, which is found in some Asian foods. Weather changes such as barometric pressure changes. So Keeping a regular schedule is very important for migraine prevention, and there are preventive migraine medicines and abortive medications. There's non-medication treatments. Injectable Botox can be helpful. There's a whole new class of calcium gene-related peptides that are given monthly that have been life-changing for many women. Biofeedback can be helpful. And we have so much information on our website about migraines and hormones, some of the myths, some of the newer treatment options. So always be sure to check speakingofwomenshealth.com. Now, what about caregiver stress? Whether you're caring for an aging parent or in-law or spouse, many women find themselves sandwiched between different generations. So ask for help, stay informed, have regular family meetings, take care of yourself, get to your doctor's appointments, accept your emotions, make plans in advance for caregiving if you know that a family member or someone that you're responsible for is going to have upcoming procedures. Find out who friends and contacts are. Financial information, having paperwork in order, having documentation of key medical history is important. Knowing about the legal documents. Does your loved one have a will, advance directives, such as a living will and healthcare proxy? What about trust and power of attorney? Where does your loved one keep documents, such as birth certificates, armed forces discharge papers, the deed to any real estate, insurance policy information? Is the will up to date? Everyone, as an adult, should address these. Create caregiver resources. It's a good idea to put a notebook together with critical information. The book can serve as a manual for other family members and help keep all records in one place. Having emergency contact information, a copy of the durable power of attorney, and any medical advance directives. Insurance information, whether that's supplemental insurance, Medicare, Medicaid, or standard commercial insurance. Names, telephone numbers, and addresses of friends and clergy. Healthcare contacts, including their physician of record and their specialty, hospital preferences or limitations, as well as pharmacy information. Having a schedule of a typical day is a guide to guiding substitute caregivers in your absence. And I think it's a nice touch to include a short biography of your loved one, which can provide a substitute caregiver with topics of conversation. The next appendix is on a word on compounding pharmacies. Since that Women's Health Initiative in 2002, many women have been inappropriately told that all traditional prescription hormone therapy is risky. And so many have flocked to so-called alternative, compounded, bioidentical therapies. And some women have been hoodwinked when they've been told that natural bioidentical compounded is safer and risk-free. That's just not true. Any hormone, including those compounded or mixed on the premises by a pharmacist, can carry potential risk like any hormone. And importantly, quality, purity, safety, efficacy are not monitored at compounding pharmacies. There's no oversight. It doesn't mean that some things don't need to be compounded if it's not commercially available or if you're allergic to something in a commercially available product. But I see women who are so fearful that they want to avoid any risk that they end up taking something riskier by taking unmonitored substances. So all compounded hormones begin with chemically synthesized hormone powders. And when you visit these customized compounding pharmacies, you don't know how much or exactly what you're receiving. The way the media, the National Institute of Health, and many physicians and media handled the results of the Women's Health Initiative study made this whole situation so ripe for charlatans, marketers, snake oil salesmen to take advantage of suffering midlife women in need of symptom relief, promising them all the benefits in the world with no risk, of course. So just like with anything, be wary of anything that sounds too good to be true. And don't just order things in the forms of creams, powders, potions over the internet. I do prescribe some medicines that do have to be compounded. Vaginal DHEA is one of the most common. Off-label low-dose topical testosterone is another one. But by and large, I favor commercially available standardized hormone products since they've been rigorously tested and have met safety standards. Do not assume that because you get treatments from a compounding pharmacy that they're proven absolutely safe and effective. And transdermal progesterone does not protect the uterus or endometrium. That's one of the biggest mistakes I see almost on a weekly basis. The FDA has approved many forms and doses of prescription hormone therapy to treat menopausal symptoms. So find a trusted expert who's trained in the area who will work with you to regulate the dose and assess treatment effects, as opposed to someone who's just out to make a personal profit from your misery. And what I have done as a clinician scholar, a professor of medicine, and a professor of OBGYN and reproductive biology is I have worked with leading experts across the country and written grants to provide free continuing medical education to physicians and pharmacists and nurses and advanced practice providers. And your caregivers can go online on menopauselearning.com and listen to lectures, download resources, get the most up-to-date references, listen to the medical podcast on Speaking of Women's Health, which is available via the Convey medical app on mobile phones. Everyone needs to be educated, to be empowered, to be strong, and be healthy, and be in charge. So thank you so much for joining me in the final chapter in the Sunflower House of podcasting, my book, The Cleveland Clinic Guide to Menopause. But don't despair. There's so many more podcasts. You can follow us on our regular channel, womenshealth.com. Please subscribe wherever you get podcasts and give us a 5-star rating. And I look forward to being back in the Sunflower House with you in the future. Remember, be strong, be healthy, and be in charge.